Watson.
What?
So I understand you're about to begin cancer treatment.
Yeah?
Alright, so I want you to know this might cause mucositis. It can be painful, distressing, might make it hard to talk, eat, swallow, breathe, you know, just basic stuff like that. It can be very inconvenient. Yeah, so you know, you're going to want to go ahead and... Oh!
What are these inconveniences? Hey, wait,
I
where
told
are you
not
going?
to call me when... Yeah, tell Wanda to fuel up the private jet. I'm due for a vacation around here. He's never... Yeah, what?
I was asking about Mr. Watson.
Who's that?
He's a 71-year-old male who came in through the ER. He's gonna start chemotherapy for Hodgkin's lymphoma due to exposure of Agent Orange while in Vietnam. Is he available for discharge?
Yeah, I guess I already did the patient teaching, and I did a pretty good job, so there's probably not much else left for you to do, so...
Okay, I have one more question.
Hello?
Some young chick in a white coat came in and started blabbering about stuff when I was sleeping.
Hi.
Oh, here comes another one.
Hi, my name's Tiffany. I'm going to be your nurse today. Side effects of chemotherapy.
The doctor, was that one young girl in the coat that was on her phone the whole time?
That was her.
Oh.
Did she explain things to you?
No, she was on the phone most of the time.
Okay, well, I'm going to go ahead and explain. So when you start chemotherapy, when you leave here for your lymphoma, you're going to have some things that might possibly start happening. So one thing that might happen is you might start getting some sores in your mouth. So what we're going to do is we're going to go ahead and show you some tools here that can help prevent and help reduce the pain due to those sores, okay?
Alright.
Okay, so I haven't looked in your mouth, but do you have your teeth or do you wear dentures?
No, they're sitting on the table over there.
Okay.
They fell on the ground a little bit ago and I just put them back in the container.
Okay, so number one thing is cleanliness. So we want to make sure that these always stay clean. So if they are on the ground, we want to clean them before we re-enter them into your mouth, okay?
Alright.
Because we don't want to get any infections in your mouth. Second, dentist. The dentist is very important. You're going to want to make sure that you do regular dental checkups and make sure that you're going to the dentist as needed.
Alright, remember that. We gotta make appointments.
I'll make you an appointment.
Okay, yeah, so dental is very important. You want to make sure that you go to the dentist, have your mouth checked, your gums checked, all that kind of stuff, okay? So, and then also another important thing is to keep your mouth moist. So, cup, water, make sure that you really use this and drink water. Are you a fan of water?
I'm not a fan of water.
If you don't
I like beer instead. It's got water in it, right? With some hops.
It does have some water in it, but you need regular water. So if you don't like water, you might be able to flavor it with some of those little water flavors or something like that. So make sure that you're doing that. And also, are you a gum chewer? You like to chew gum?
Yeah.
Okay.
I just have this. This works for me.
Yeah, well, that's probably not the best thing to be using. But you can use some sugarless gum or some candy to try to kind of keep your mouth moist. And then, so second, you're going to use a soft toothbrush. You don't want to use a hard toothbrush, so you might have to go out and get a new toothbrush. And you're going to clean your teeth and make sure that they're clean before when you first wake up and when you go to bed. Okay?
Are you writing all this down?
I don't know.
I will give you some handouts when we're done. That way you can take them home and read them. Okay?
Thank you, because I forget sometimes.
That's fine. And warm water is good for your mouth. That cold water might irritate those sores, so warm water is a good thing to use. Also, it's good to rinse your mouth out with warm water. And then, as far as flossing, you're going to want to floss your teeth. Make sure that the teeth are all nice and clean, and do it gently. We don't want to floss until our gums bleed, because that can irritate and cause sores. And then I'm just going off the checklist here to make sure that, and then I'll give this to you when you guys are done, okay? And then you want to choose, what's your favorite types of food?
I like all kinds of food.
Okay, so you want to choose foods that are nutritious and easy to eat. So stuff that is like
chicken
swallowed.
tenders?
So not chicken tenders.
No pizza?
Well, pizza could be soft, but it might not be the best health choice. So you
My
want to
two
do
favorites
like
are gone.
mashed potatoes, scrambled eggs. If you have trouble swallowing, stuff with like gravy, Yogurt is a good one because it also helps with healing processes. So no toothpicks. That's probably not the best thing to have in your mouth either. No
It's
sharp
been
and
there
crunchy
forever.
foods.
I always keep it around. They say then we can just transfer it up to here.
Okay, we'll keep it transferred up there for now. And then, so if you have any mouth sores or infection, then we might have to go into something else. So these are 3 different types of mouthwash we have here. So one has alcohol in it. That's not good. That's going to burn your mouth and it's not good to use. This one is alcohol free. So right here.
How do I know it's alcohol free?
It states alcohol free.
Oh.
That's a good one to use. And then one that the doctor might give you a prescription for is Magic Mouthwash. And it has
What's
kind
so
of
magic about it?
It has kind of a magic quality to it. And it has different stuff
It's a magical mouthwash.
inside there. And
Sounds like a
it
magical cigarette.
includes lidocaine, which will keep your mouth numb. And then you also might have to end up using these swabs instead of toothbrushes, which are softer for your mouth and won't hurt your gums. And then just
Sorry,
make
I don't like brushing my teeth anyway.
well, we need to make sure that you brush your teeth
Oh
because
man.
that's very
Just like the battle axe over here. Always tell me what to do.
That's very important to brush your teeth. So, because you don't want to come back in here for mouth sores, do you?
No,
This is probably not your favorite place to be.
no, definitely
So,
not.
you want to make sure that you take care of your mouth. So, signs that you should look for that maybe make sure that the mouth sores are getting infected. Make sure that you don't have a fever. So, if you start feeling hot, chills, nausea, vomiting, if you start feeling your heart beat real fast, or if you have any like redness or swelling or pus leaking from your mouth, that would not be a good thing and you need to call your doctor. Do you have any questions for me?
No, not right now.
I think as long as you leave the paper.
Okay, I will leave the paper. So what I want Mr. Watson to do is to kind of demonstrate to me that he understood. So we're gonna go ahead and
Oh man, we got a
we're
test
gonna
now?
do a test.
I didn't know there was a test.
Back to me so that I can
Alright,
understand.
I better take these off then.
Okay, and make sure that you understand what I taught you today so that you're able to do this at home. So we have 3 different types of mouthwash. Is this a good one to use or not?
Is that the magic one with the weed in it?
Huh? The weed, but it's a magic mouthwash. So is this
Yeah, you said that one was good.
Okay. And then between these two, alcohol free and alcohol, which one would you want to choose?
You said no alcohol.
Correct. So good job. And then as far as hard or soft tooth bristles, which would you rather use?
We're using the soft
We're
one.
using the soft one, correct. And so can you kind of, this one's actually the soft one. Can you kind of show me with this big mouth here that I have what you would want to do?
Alright, go in there, and then we get this stuff out. Go there, get down there, go inside, get in there. Just like that.
Okay, and then this kind of looks like it may be a little bit of sore. So if you see a sore, what are you going to want to do to make sure if it starts, like maybe you start getting fever or chills and you have a sore, then what are you going to want to do?
What are we gonna do? Call the doctor?
Go to the doctor.
Correct. Call the doctor, make an appointment, go in. And then you want to, what else? You want to floss your teeth, right?
Yeah.
Softly.
So,
She said softly.
Softly. No
So are you
bleeding.
going to go crazy and floss your teeth?
Nah, you don't want your gums to bleed.
Okay, yeah, we're gonna softly brush and get all this junk out of our teeth, okay? And then lastly, are we gonna drink beer or are we gonna drink water?
We gotta drink water.
Okay, and then what can we put in our water just in case we don't like water?
Sugar-free.
Sugar-free
Sugar-free flavor.
Correct. Good job. Okay, so I think that is pretty much all I needed to teach you guys. So are you guys understanding this teaching?
Yeah, I'm gonna Google stuff just in case though. but
Okay.
I think I
Okay.
got it.
You
I
think
think
you
it'll
understand?
be okay with the paperwork you give
Okay,
us.
and then yes, and then I'm gonna go ahead and hand you guys paperwork.
The jet's ready? Perfect!
Here's your paperwork, okay? Thank you for letting me take care of you, Mr. Watson, today.
Thank
and
you.
good luck, Miss Watson, okay?
Thank you.
Hey, babe, look at this. This thing's almost as big as your mouth. Look at that thing.